Welcome to another edition of Dan Frequently Asked Questions. In this edition, we'll be discussing the implications of ear pain after diving. Keep watching. We got a question from a diver asking what to do about ear pain after diving. Well, first of all, ear pain in general in relation to diving has one of two causes. The one is an infection of the external ear, which is the second most common cause of ear pain, but is unlikely to result from a dive specifically. In other words, an individual dive is unlikely to cause it. A series of dives may eventually lead to it. What is more likely is that there is middle ear barotrauma because of eustachian dysfunction or a lack of equalization during diving. Now, it's difficult to grade or assess the degree of barotrauma simply on symptoms. What is important is whether the person is able to equalize after the injury so that the pain actually abates and the ear is able to heal, as it will if it's able to equalize. But sometimes the more pressing question that the diver has is whether they can continue diving. And the answer to the question is really this. If there is continuous ear pain, if there's ringing in the ear, or if there's deafness, then the degree of injury is likely to be such that it's wise to first get medical advice before returning to diving. If the ear pain is fairly insignificant, terminates fairly shortly after a dive, is not associated with ringing in the ears or deafness, then it's unlikely that your ears have been significantly compromised if you are able to equalize without difficulty. So the key are two things. Can you equalize easily? And is there any deafness, ringing in the ears, or even vertigo and dizziness? If there are no symptoms, there's no pain, and you can equalize, chances are you'd be able to dive safely. Thank you for your question, and until next time, safe diving.